Okay, hey everyone. So, welcome to today's current event stream. So, obviously, there's been a lot of confusing, conflicting information that's been going around about coronavirus, which is now just called COVID-19. And so, we thought we'd do a viable stream about exactly what it is and taking in all of the different perspectives, whether they're from the scientific perspective or the historical perspective when it comes to pandemics and do one big stream explaining exactly what's going on. And so, welcome to today's stream. Today, me, Brandon, Carolyn, and Eric are all going to be joining all of you and breaking down exactly what's going on. And follow Fiveable on all of their social media before you do any of that. So in this stream, we're going to be talking about the historical context, like the Black Death and the flu. And then we're going to be talking about the science behind COVID-19 and then exactly how to prevent the risks and the future outlook and exactly what it's going to be going into the next few months before looking at some of the political actions that have been taken and some of the global and local consequences that COVID-19 is going to have on things like politics and the economy in the next few years. So let's get into it.
Right. So hi, I'm Eric Beckman, and I'm an AP World History streamer and content creator here. I'm also what we might call a longtime listener, first-time caller into the Monday night current events stream. So I'm happy to be joining this group. I think it's very valuable. I've enjoyed tuning in myself from time to time. So I have just a couple things to say when this came up in our Slack channel discussions about how history can give us some perspective. And so I have a quotation up from an article that I linked in the resources underneath the screen there from the Washington Post. It's a pretty good article, although the person who wrote it isn't a historian, and actual historians of disease would probably quibble with some points. But the author, Ishan Tharoor, makes a really important point that disease history really is history. And so I think one thing that thinking about this historically can do for us is help us understand why it has struck such a chord, whatever the ins and outs of how serious the epidemiology of it winds up being, that pandemics and epidemics in history are very large, like epoch-defining events. And so there's really nothing unusual. Now, of course, historically, we remember the ones that have the greatest impact, and this may not wind up making the cut in that way, but it does kind of help us understand how, as humans, we relate to this as something that's very fundamental. Okay. And one of the people, who I've really come to rely on, and I linked one of her tweets in the resources, is a medieval history and medieval medicine. So med history works a couple different ways in her handle, Monica Green. And she's a great follow on Twitter for those of you who gather information in that way, especially for teachers. I know there's a few world history teachers in the house here tonight. And she makes and kind of the basic point that really pandemics are emergent disease plus exchange networks. And in the thread where she talked about this, or maybe it was an article she linked in there, she said, really, we think of the Black Death, which is one of the big events, the bubonic plague, which is one of these big world history topics. I imagine a lot of people have talked about the Black Death in either an AP Euro or an AP World as students or teachers, that the bacterium that causes that, Yersinia pestis, that's older than humans. And when humans moved out of Africa 200,000 years ago, they ran into it. And in the Central Asian steppes. So really thinking about pandemics and disease is about thinking about human mobility and human contact and how we interact with each other. And I think we see that now. There's med students from India who contracted the COVID-19 while in med school in Wuhan and went home to Kerala, all these different maps that we might look at. So I think it's really just a sort of a global point as someone who's thought a lot about this recently, because we've learned a lot about the Black Death, and I've really changed how I explain it to students based on new research. There really are some sort of global lessons So I'd like to take a look at two specific instances that are useful in other classes for you, and that also might help us with some insight here. The first one is the Black Death, which is sometimes called the second, or can be called the second plague pandemic. The first one is associated with the reign of the Byzantine Emperor Justinian, so that's in the 500 CE. And then this would be the second one, and the third one would be in the late 1800s, which is when the Yersinia pestis bacterium was identified. So we had microbiology then. The new tools of studying the plague are basically genetics. So forensic or paleontology, what is it called? Historical paleontology? I forget. Historical genetics. But what researchers can do now is they've found ways to get genetic material about the bacterium that causes the Black Death from skeletons. I think teeth. And what that's done is it's really opened up a lot of new information. And that process started in 2004. So any information from before 2004 hasn't been informed by that. So I think about myself, 2004 is the first year I taught AP European history. And so I learned something about the Black Death teaching that class, and some of that's wrong, as it turns out. Now, other things have been confirmed. So in 1894, people guessed that this Yersinia pestis bacterium was the cause of bubonic plague, and that maybe was the cause of what medieval people in Europe called the Black Death. And that's probably true. And it was extremely lethal. If anything, this isn't necessarily encouraging, but if anything, the Black Death was more lethal than what we think it was. Because the kind of evidence that has been used to put together mortality rates doesn't exist everywhere. So you notice, like, if you look at this map here, which isn't completely wrong, and I bet many of you have seen a map like that. Anybody seen a map like that in your world history class or even used it? This is from World History for Us All, but there's a real similar one in the SHEG Stanford History Education Group materials on the Black Death. Well, here's what's right about that. All those black dots are places where there's documentary evidence of people describing deaths that look like the Black Death. And in the Black Death, people's skin turned black, like black. And so it's one of those diseases that there can be useful historical documents, because we know people describing it, we're probably describing that. If you read like medieval medical stuff, there's a lot of words that we don't use anymore, like flux. Like, what is that? It could be like any bodily fluid. But with the Black Death, the textual sources that historians like to use probably tell us that people had it because of what they're doing, because of what they're describing. So those textual sources, like those black dots on the map there, those are places where people had the Black Death. And we can go and then look at like census records from, like in China, tax records, church records in Europe. But places that didn't have as many written records, like say sub-Saharan Africa, or places where the records were perishable, like the Indian Ocean, like we don't really know. And so it's likely that a lot more people actually died than we think. The thing of what the genetics has shown wrong about this map, and this is really pertinent for today, because I have wrong over there on this tweet from the Daily Beast that an AP World teacher put on the AP World thread. That is, just like the, Great Plague, the coronavirus started in China. I mean, wrong. So I think it's like with the Spanish flu, we named the flu after the first place that people noticed where it was. That doesn't mean that's where the pathogen comes from. And in the case of the Black Death, the best evidence now suggests that there's sort of a reservoir of plague in Central Asia, Eastern Europe. And that sometime in the 13th century, there was kind of a big bang where different strains developed and then spread out in different places. And that origin point is somewhere between like Tibet and the lower Volga, like southern Russia. So it's not accurate to say that. And of course, we have this issue with xenophobia and anti-Chinese sentiment, and this thing started in China. I mean, that's We'll find out where it started, but probably not for a while. So that's one lesson from teaching this that I've kind of kept close, is the idea that we don't know as much as we think we know. And the kind of evidence we have right now of where people have the disease is similar to the evidence that produced this map, which is partially correct. It shows us where cases were, but it doesn't really show us where the spread was, because the genetics now tell us that the pathogen in Eastern Europe was different than the one in Southeastern China. And of course, if you want to call Tibet part of China, that's an issue for a whole nother current events, world history stream. Tibet and Wuhan are like 2,000 miles apart, so it's not the exact same place. I'll just say one more thing, and then I know that the bio questions are going to be a lot more interesting to people. So one other thought I have, if we take a look at the other slide here, the influenza pandemic of 1918 is another important case, and this is, again, something that I assume a lot of people who've taken AP World have studied, and of course killed 5 times as many people probably as World War I. I mean, more people died in India from influenza, that pandemic, than died in all of World War I from all the countries. One thing that I think this shows us, like I said, is it's called the Spanish flu sometimes. And that's because the first cases were publicized there. And that's probably because Spain wasn't in the war, so there wasn't as much censorship. And so the cases were publicized sooner. So it's not actually that those were necessarily even the first cases. And the Spanish king got it, so that was tough to hide. So we have that. But the other thing that this shows us as an emergent disease is the way power and colonialism come into play. Because if you notice, if you look closely there, you can see the spread coming from what, it's all coming out of the Western Front, right? It spreads out of the Western Front in Northwestern Europe. You can kind of follow it around Africa as the British dropped off colonial troops and laborers at the end of the war. And the British, in their racist colonial policies, didn't follow the same quarantine procedures in Africa and India that they followed in the home nations. And so as a result, they just dropped people off. And so you get these, studying this more closely, I've seen the big outbreaks in Sierra Leone, South Africa, East Africa, and then South Asia. The highest mortality rates in the Spanish flu of 1918 are in Fiji, where like 1 in 4 or 5 people died, which is a British colonial possession, because you had this small and drop people off and they were still infected. So what that tells us, though, like the hopeful lesson from that is that now these countries are independent and they can say no, or they can monitor their own, they have that ability. And so that kind of sovereignty is important. Also, most people who died of the influenza of 1918 didn't die of the flu, they died of pneumonia. And today we would treat that with antibiotics. So we do have some other tools. So I think, I just wanted to kind of add those things in as perspective, that we don't know as much as we think we know right away. And so it's important to gather information, and that power and social hierarchies matter. So those are sort of my world historical thoughts, and I can take questions or I can drop out for the probably more important biological talk. So.
Okay, so it looks like right now the questions kind of are revolving around like the disease a little bit more. So if everyone wants to say bye to Eric and thank him so much for all of the input that he has provided and the perspective, see you later, Eric. Thanks for joining us.
That's great. Thanks. And you can follow me on the Twitters. There's a lot of conversation about it going on in the AP World community. So good night.
Okay, so now Caroline is going to go a little bit more into exactly what COVID-19 is. And so I think a lot of y'all's questions that you submitted are going to be answered here. And so, yeah, take it away.
All right. Well, hi, guys. Thanks so much for joining tonight. I'm Caroline. I don't usually get to stream about history or anything exciting in this land of things. I was an AP Bio teacher, and now I'm a nurse. So I have kind of a different perspective on this, but I stream for AP Bio. So I'm happy to be here with you guys tonight. And I can definitely answer both questions that are that have been asked below. And then if you have any more, I would be more than happy to answer them as well. Okay, so COVID-19. So the first thing to know is that We do call it COVID-19 and not the coronavirus, because the coronavirus is a family of infectious diseases, including the common cold. So you've all had coronavirus before, I am sure. I know a lot of people were freaking out because they thought Lysol rebranded and put that it would kill coronavirus on there. And it's always said that it would kill coronavirus because coronavirus has been around for a very long time, and it includes a whole family of diseases and disorders. So this is COVID-19 for this specific strain. As a reminder, this is a virus. So if you are being treated, you are not being given antibiotics. If anyone tries to give you antibiotics, they're not the person that you should be talking to, because that's how things like antibiotic resistances form. And it's not going to do anything to help you. If anything, it might kill your natural bacteria, which are trying to help prevent against this virus. So treatment for this would just be supportive care. So think about things that you would normally do for yourself, fluids and like healthy eating and like an antipyretic, so something to bring down your fever and your pain, so something like an Advil or something like that. Those are the kind of treatments for especially mild cases. And I can talk more about what that means for a severe case as well. As you guys are probably familiar, this involves mainly respiratory systems. So what happens is when you inhale the virus begins and ends in the lungs. So it's going to infect your lung cells, and it actually starts to kill those lung cells. And when those lung cells are being attacked, so you have two different types of cells in your lungs. When those lung cells are being attacked, they are releasing their contents as well as the viral contents, which can provide fluid and inflammation in the lung. Okay. Once your immune system starts to get involved, that inflammation only increases because that is part of our natural defense system. So then you have swelling and you have fluid in your lungs, which could lead to something like pneumonia, which is when you start to have these pretty severe respiratory symptoms. So that's what's happening, which is why the main symptoms are fever, because this is an infection. So our body is heating up in order to try to protect ourselves. A dry cough, because you're not coughing up mucus, you just have inflammation, and then shortness of breath. So that's the pathway. If you're really interested in science, and I'm sure some of you are, there's a link that I can send you guys. I'll actually post it right now from National Geographic. That kind of explains more of the nuances here, but that's kind of a high level. Something that's really important to know is this spreads via droplets, not through the air. So there are certain things that actually can spread through air. This spreads through droplets. So mainly if someone coughs or sneezes very, very close to you and you inhale those droplets, that's when you're going to get infected. That is why masks, those paper masks that people are stealing and that hospitals are having to lock away with their opioid medications, are not effective. So do not spend $700 on a box of masks, because they will not prevent those little droplets from getting around. The only good thing that masks can do is help you prevent you from touching your face, because that's something that we subconsciously do very frequently throughout the day. Obviously, that's a vector for disease. Or if you're actually sick with the disease, that's something that you would want to be wearing in order to protect others, but it's not perfect. Okay, so little disclaimer about masks. The other thing, and I probably should have started with this, is that we don't know a whole lot about this virus. It is constantly changing the information that we have. So that goes right back to what Eric said. New things are going to be coming out constantly. And part of that is the fact that I'm sure someone else with more historical context or governmental context will talk about this, is that China's government is not super forthcoming with information. So we don't know when this started, and we don't really know all of the details about patients that have been infected. So more information will come as we find out more. So far, what we know is the incubation period is anywhere from 1 to 15 days. That is an incredibly long range. And the incubation period would be from when you're actually infected to when you show symptoms. And during that time frame, you can actually be transmitting the disease to others, but it's actually not super, super likely with COVID-19. So there are other things. So incubation, again, Ashley, is that time between when you're actually infected, so someone sneezes on you and you breathe it in, and when you actually start to show the symptoms. So the virus during that time is incubating, or just replicating inside of you until it gets to the point where you actually feel sick. Some other infections are a little bit more common, that you would be super, super susceptible to transferring your germs during that time when you're not feeling sick. And it's So far, not looking like that's as much the case with this. But that's another reason why we need to be really careful and why people are being quarantined for 14 days, because we think it can actually take that long for you to start showing symptoms once you've been infected. What we do know is that children are a lot less susceptible. So that's really good news. Oftentimes, children and the elderly are the most affected by these things, like the flu virus. But in this case, children are much less susceptible. The problem is they can actually act as carriers because they may have no symptoms or very, very mild symptoms, even though they're infected. So think about it. If you just have a little cough and you're a kid and it's the winter and that's normal, you're probably not going to think anything of it, but you could pass that on to someone who could get really, really sick from that. So that's kind of something interesting that they're looking into with kids. What we also know right now is that testing is severely limited just due to the fact that we don't have very many tests available. And so I'm saying all of this to tell you that these numbers are probably also entirely skewed as well. So for reference, Seattle has the highest number of tests. They're probably the most prepared for this outbreak. They also are showing that they have the most cases, but a lot of that could be because they have the tests to actually get the corona diagnosis, the COVID-19 diagnosis. Okay, so a lot of this is skewed because of that. And then information is constantly changing, as I said. So there's a link on this PowerPoint. I've been following Johns Hopkins for the majority of my sources. I know someone else is going to talk about it, but it's kind of hard to go through a government source when the government can skew information. So I like to go through private sources. I trust Johns Hopkins immensely. And so there's a link on there. They have an interactive map that you guys can take a look at. But that's what I've been using for a majority of my information, or the World Health Organization. So before I go into risks, oh wait, yeah, we can talk about risks. You can keep this slide up. I did want to answer these first two questions. So how deadly is this? So we don't really know, but the most current calculations are somewhere between 2 and 3.5% of people infected with the virus are dying from the virus. That number actually might be too high given the fact that people can have very mild symptoms, and therefore they're not actually counting in the number of cases because they're never getting diagnosed, if that makes sense. So we actually may have a higher number of infected people, which would bring down the percentage of people dying from this, but it's somewhere in that range. To compare that to the bubonic plague, it's nowhere close to as lethal as that. That was like 30 to 60% of the population. But the common flu is less than 1%. Okay, so less than 1% for common flu, way more than that for bubonic plague. So we're kind of, we're way closer to flu than bubonic plague, but we're kind of in the middle somewhere. Why are people saying that it's not as bad as the flu? Probably because not as many people are dying. A lot more people number-wise have died from the flu than have died from COVID-19. But that's because a lot more people have been infected by the flu than have been infected by COVID-19. So the percentage of people who are dying is higher for COVID-19. So it is more lethal than the common flu, but more people total have died from the flu this season just because more people have been infected with it. So hopefully, Catherine, that answers your question, and someone else asked it as well. I forgot. So I can get back into that as well. Okay, so some risks. Here are the people who are most at risk: people who are immunocompromised. So people with chronic illnesses, people who have heart problems, diabetes, things like that. Those are people who are going to be more susceptible to getting this. Individuals over the age of 65, but it jumps even higher as you get over 80, just because your immune system is less functioning. And then people who live in certain geographical locations. So individual risk is truly individual. It depends on the person. I think what's important to remember is even if you are not at risk, it doesn't mean that you couldn't put someone else at risk. So what I've heard a lot of students say and my friends say is, oh, I'm going to be fine. And you probably are. And I probably am too, even if we get sick with this. But you have to think larger than yourself, because you're going to be potentially exposing people who might not be okay. And so that's something important to remember. You might be okay, and there's really no need to have a super heightened panic, but you also shouldn't be apathetic about it, because there are lives that are going to be at risks, and you do need to keep that in perspective. What can you do? Sorry, I know I'm talking a lot. What can you do? Most importantly, you've heard this a million times if you've watched the news. Wash your hands. But what does wash your hands mean? It means if you want this to be effective, 20 seconds. It's a happy birthday song times 2. It's a really long time. My skin is like falling off of my hand right now. It means you need to go under the nail. So that means like this, get a little nail brush, get in there between your fingers. It means warm water. If you feel like you can't do that every time, then you should be using hand sanitizer. It needs to be at least 60% alcohol in order to be effective. And I know if you guys have been paying attention, Purell is like sold out. It's like $100 on Amazon right now. It's sold out of all the grocery stores in Chicago. You can make it yourself. You just need isopropyl alcohol, which you can find at a grocery store or a drugstore. It needs to be greater than 90% though. And you're going to mix 2 parts of that with 1 part of aloe gel. So like something that you would put on your skin if you got a burn. You can mix that up and it'll do the same thing, but it will dry out your skin more than a traditional hand sanitizer. So you just want to be careful with that. You need to avoid touching public service or surfaces. You shouldn't be shaking hands, shouldn't really be touching elevator buttons or door handles. So use your sleeve, use something like that in order to do those things, because again, scientists give us this really vague, like a couple of hours to a couple of days, and that this virus can live on hard surfaces. Of course, stay home if you're sick, hydrate, and make sure you're vaccinated, because you actually would be more susceptible to flu or more susceptible to coronavirus, depending if you have either of them, right? Because our body's immune system is a little bit compromised. So Nina, it needs to be greater than 90%, because when you're mixing it, you're diluting it down to 60%, because it's 2 parts of isopropyl and 1 part aloe. So in total, it will be 60%, but you need 90% since you're diluting it. Okay. Amanda asked, if you come into contact with someone that has it, but you aren't showing symptoms, should you be worried? That's a really great question. You need to take care of yourself. So you need to first ask yourself, how close of a contact were you in? Were you within 3 feet of this person? If not, you're probably okay. May you have touched a shared surface? Were they coughing at the time, right? Because coughing, not just looking at them is going to get you the disease, but were they actively coughing? Is there a way that you would have inhaled those droplets? If so, you should have been contacted by the CDC, the Centers for Disease Control, because they should be quarantining you. So it really depends on how close of a contact, and that would be something that you might want to call your doctor and say, hey, do I need to self-quarantine myself? Do I need to stay home? Just depending, right? Because you will be asymptomatic potentially for a week or 2, but you could be spreading the disease at that time. So you really do need to be careful. And again, even though you might be okay, someone that you're spreading it to might not be. So it's important to think outside of your bubble. Okay, cool. Let's move to the next slide, and then I can answer some more of these questions, or we can always save them to the end if we feel like we won't have time. Okay, so the outlook, the biggest takeaway here is that we really don't know what this is going to look like. A lot of doctors and scientists are thinking that we may see a regression in warm weather. Typically, coronavirus, like many other viruses, prefer dry and cool climate. Obviously, that's not what happens when it's warm and humid. Okay, so it's possible that we will see a strong decrease once things start to warm up in the next few weeks. If that does happen, it's also very likely that we may see a resurgence of this, because it kind of goes dormant over the summer during the next flu season, so fall and winter. The good news is, if we do see a resurgence next fall and winter, at that point, we should have a vaccine ready, which would be amazing and obviously would be perfect for those people who are at highest risk. There are predictions out there as dramatic as the fact that 50% of the United States may be exposed or get this at some point. It's really hard to know for sure. So we do have enhanced infrastructure. We do have really strong medical systems. That's why we've been able to control this so much better than Italy has, because we both kind of started the same way, and now they have 8,000 cases, which is a huge percentage of their population. So just know that we have enhanced infrastructure. Is there reason to freak out? I truly do not believe so. But again, you just need to be careful. You need to take care of yourself. You need to have good hygiene. You need to be, listening to the news, and all of those lovely things. These comments seem a little bit more general, I think. Yeah, I think a little bit more common. So maybe we'll press pause on those since we only have 15 minutes left, and let Brandon do his. And then if we have time at the end, I can answer those.
Okay, sounds great. Thank you so much, Caroline. And now we're going to take a look into what some of the political and geopolitical handlings of COVID-19 has been. And so, a lot of what's been happening, especially in the United States, is that the Trump administration hasn't been doing a great job of putting out like cohesive information that's like backed by like scientific data, right? So, just very recently, like within the last week, there was a cruise ship that was marooned off the coast of California because it had a few COVID-19 cases, right? And so the thing about cruise ships is that because they're like, it's such close quarters and there's hundreds of people on them, disease can spread very quickly. And so health department officials and VP Mike Pence, they wanted to evacuate those passengers in order to like quarantine them and make sure that we didn't end up with like every single person on this cruise ship having COVID-19, right? And so there was a moment where President Trump wanted to leave all of those people that were on this cruise ship on the cruise ship because he didn't want the number of cases that were in the United States, confirmed cases, to rise exponentially. And so that was not it's not exactly the best way to handle a situation where you have a bunch of infected passengers, right? You want to make sure that they're being treated and that they're being quarantined. So that was a moment where that really put the spotlight on how the Trump administration hasn't exactly been doing the best in making sure that they're getting treatment and effective communication out to the public. And at the exact same time, there was a moment where President Trump said that anybody that needs a test can get one. And so he also said that none of the tests were faulty at all. But the issue with that statement was the Secretary of Health and Human Services, whose name is Alex Azar, said that you can't get a test unless it's prescribed to you, which is true. You can't just like walk into a doctor's office and be like, I want a COVID-19 test. That's not exactly how it works because right now, health officials are trying to prioritize people who are most likely to be infected with it because the number of tests and kits that have been sent out across the country, the first round that went out, some of them were actually faulty. And so they weren't actually giving conclusive results. And so there has been an issue with tests. And so the rollout for having public health be well cared for hasn't exactly been like perfect. And so it has been the response to COVID-19 has been like botched in many ways. And so to touch on what Caroline said earlier, she mentioned why she's looking at John Hopkins' report of how many cases of COVID-19 have been confirmed. And that's partially because officials at the CDC have been like reported to say that they want to keep the numbers, especially on the website, low in order to make sure that President Trump doesn't get angry. And so when you think about making sure that people in the public are well informed about what's happening, especially in like a health emergency such as this one, the Trump administration hasn't been doing a great job of making sure that people are well informed. And so it's also had a pretty major effect on how campaigning is working. So President Trump, every single time throughout the primary season that Democrats have had a debate or some kind of major primary, there has been like counter programming. So he's held like a huge rally. And so for the first time in all of the primary season, this isn't happening. And so there's a couple different reasons. One of them is because there was recently a conservative like conference that happens every single year that's called CPAC. And so coming out of it, two people who are in Congress, one of them is Senator of Texas, Ted Cruz, they decided to self-quarantine because there was someone at the conference that had COVID-19. And so they ended up like, in order to make sure that it doesn't like spread in like these huge rallies, and so also to take extra precautions and make sure that like the president doesn't get it, they've decided to like not have a rally before tomorrow's Democratic primaries. And so this has also been it's put a spotlight on how important public health and economic support for people is. And so Senate Minority Leader Chuck Schumer and House Speaker Nancy Pelosi, they put out a joint statement saying that they have to prioritize the needs of families and workers over major corporations. And so they, in the statement, argued for things like paid family leave and free coronavirus testing, and anti-price gouging protections. And so the reasons why they were saying that this was so important was specifically because of the fact that if you're sick and you still have to like get paid, especially if you're like an hourly worker, it's a lot harder to take time off and not be spreading this disease or spreading this virus if you have to balance and decide between being able to like get paid and provide for your family or stay home and get better. And so a few hours ago, President Trump agreed on some of that and said that there would be emergency measures like a temporary payroll tax cut and expanded sick leave. And so he'll be working with Republicans in Congress in order to get that passed. And so now Brandon's going to take it away and talk about some of the long-term economic and political implications.
All right. Hello, I'm Brandon. I'm on the AP Lang team, but sometimes I come every other week to these current event streams. So in terms of the global and geopolitical implications of COVID-19, there is a lot that could happen. And that's kind of the worry. That's why the Dow dropped 2,000 points in the stock market. That's why we're seeing that there's a lot of worry, especially since like the airline industry, like aviation as a whole has not been too great in the last few weeks. That's why you might have heard on social media, especially about how like flights to Italy are like $60 or like cruise ships are really cheap. And that's because there's a lot of worry about people traveling. And since tourism makes up a large part of many countries' GDPs, it means that in the short term, a lot of people may see that like their countries may fall into recession. But beyond that, like in China, we see that because they do so much manufacturing, it might be problematic that, you know, companies in America and in other places may be less inclined to buy Chinese products. We're seeing that China's initiatives to expand their political sphere, you know, their Belt and Road Initiative in Africa and Europe, where they're trying to, you know, do infrastructure projects in countries like the Democratic Republic of the Congo. We're seeing that a lot of those projects are being put on hold. And problematically, if we see China's economy fail, it means that there's probably going to be a cascade or a domino effect in which other countries who rely on China for like imports and exports will also see a decline in their economy. Also, we've seen that falling oil prices are really hurting the Middle East and Russia. It's sort of the issue of supply and demand because less countries are demanding oil in the status quo, because we're seeing like the aviation industry collapse, right? And we're seeing that people are less inclined to travel. They're staying home, even like with their cars. It means that gasoline prices are really low, but no one's buying them. So it means we're also seeing companies and even entire countries who rely on crude oil production and importing, like those economies are also slowing down. We're also seeing that in Iran, they actually like underreported the number of cases they had. And then it was like discovered by, I think, the World Health Organization or some international observer that Iran actually had more cases than they said. And consequently, people who are already less inclined to trade with Iran are even less inclined to like buy products that come from that country. And since they're already isolated enough in the world, we're seeing that, you know, at the end of the day, the people, not the government, are going to be harmed the most in Iran, since unfortunately, we're just seeing that people are just wary and not willing to trade with them. We're also seeing that US-China tensions are increasing in the status quo even. So right now we see that President Trump has blamed President Xi and the Chinese administration, President Xi Jinping's administration, for not really handling coronavirus or COVID-19 correctly. And honestly, there is some validity to that argument, given that the first like detection of COVID-19 was in late December, but it's March and we're still talking about it. And problematically, like the Chinese government censored the doctor who proclaimed on social media in China that there was a virus that was very easily spreadable, similar to the flu. And then they made that doctor sign basically sort of signed like a non-disclosure agreement. He basically had to say that he lied to everyone on social media and that there was no virus. But then 2 months later, the doctor got sick himself, and he started like posting on social media about how he caught COVID-19 because of like the lack of proper like administration of procedures in China, especially in Wuhan. So yeah, we're seeing that American tensions with China are like rising even after the trade war, where President Trump placed taxes on Chinese goods from coming into the country. So there's the potential for more conflict. In the European Union, we're seeing that Italy, as you may have read, just a few hours ago, actually declared a lockdown. So no one could leave the country, no one could come in the country, no one could move even, like Italian citizens had to stay put. And already we're seeing that after just a few years back, we saw that Italy went through a political crisis in that they had a lot of debt that they couldn't pay off, and the EU had to bail them out. We're seeing that a lot of people are speculating that the EU may fall apart as a result of having to bail out Italy again, things like that. We're also seeing that the whole argument of the European Union of freedom of movement, where we can have goods and people travel with open borders within Europe, that's something that people are saying may not be true in a few years, especially if COVID-19 continues in the following months. And this graph right here on the right sort of illustrates the historical epidemics. So on the left, it basically demonstrates that the risk of death of COVID-19 is still less than like plagues in the past, even like Ebola, which had like a 40% mortality rate. But it still shows that you need to be cautious, especially since we're seeing that COVID-19 is spreading immensely. It's like, for instance, in my county, they found like 3 cases in the last few days. Most of them are like people who were already isolated or traveled, but the chance of community spread is like still high. But after global implications, there are also like implications in America. So as you can see, that map right there from Live Science shows the number of cases in which states. As you can see, it's pretty close to getting to all 50 states, although I'm not sure about Alaska. Canada, I think, had their first death recently. We're seeing that American economic growth will likely be as low as 1.3%. And problematically, if economic growth slows down, we're seeing that recession is really going to hurt President Trump and the Republican Party as a whole, as it did in 2008 after the real estate industry had a whole issue. It's a lot of explaining to do. But basically, because we had a recession under the Bush administration, people were more inclined to vote for the opposite party, the Democrats, which is why I would say President Obama got elected into office in 2009, partially because of that recession that happened in 2008. Also, we're seeing that festivals and classes are getting shut down. South by Southwest here in my state of Texas got canceled. UC Berkeley, Princeton, I think Rice University, they've all shut down classes, at least for this next week. Even my school district is like, basically they have to like re-sanitate over spring break, which is this week for me. So they're going to all of the different campuses and like spraying, making sure that like the virus doesn't spread even more. We're also seeing that like the Federal Reserve, which kind of works to influence our economy, cut interest rates. So for those of you who have not taken AP macroeconomics yet, that just basically, or like a dual credit macroeconomics class, basically when you cut interest rates, it just means that you are trying to prevent the onset of a recession. You're trying to increase investment. You're trying to offset the potential of a slowing economy. Yet I would argue that it hasn't done much. Given that the Dow Jones, which is a stock index, fell by 2,000 points. It's actually the worst crash since 2008 and the largest point decrease ever in American history. And yeah, businesses unfortunately are losing money. I've also read it among a lot of places that especially Chinese American owned businesses, Chinese restaurants especially, are getting hit hard as a result of COVID-19, the fear of xenophobia. Even in my city of Houston, we saw that there was like a rumor that flew around on Twitter that one of the supermarkets had employees from Wuhan who were infected. And then like that day, no one went to the supermarket, which is really problematic for like small businesses like that. So we're seeing that there are a lot of we're seeing that the structural like fear and the xenophobia that kind of happens as a result of like your fight or flight or like your fear instinct that's coming out. And that's kind of problematic. So we all need to make sure like taking our own initiatives to not, spread xenophobic remarks, not, make jokes about how like, oh, you might have corona or things like that. But I would say that, a lot of people are using like humor to cope. And I guess I can understand where that comes from. It's just you need to be wary, especially with spreading misinformation, because I think especially even in the Trump administration, we're seeing two different messages come out from the CDC and President Trump. One person is saying that we're going to have 1 million test kits every week. Mike Pence said, oh, just kidding, we only have 350,000. So make sure that you are, getting information not just from one source and things like that. So yeah, this is technically like the last slide of content, but I think we can like open it up to answering those questions, because I didn't want to just have my own opinion. I wanted everyone's input on these questions. So yeah.
Okay, so Isabella really wants her question answered. So she's asking about how, she says, a big reason as to why COVID-19 has become so widespread is because it has become common in areas with large populations. And it only particularly affects those with a weak immune system. Of course, it's bad. However, different news sources are definitely overreacting a bit. We have faced far worse viruses as a society before. Thoughts?
I can jump in a bit. So I'm a little confused when you say common, just because I'm not positive if I would consider any area being or having this necessarily be common. But I think it may become so. And are we overreacting? So I do think some news systems are overreacting. But I also think you kind of have to check when you're saying that it only affects individuals with immune systems, because there are a lot of those people out there and their fears are very legitimate, and you could be a carrier. And even though you're going to be okay, you kind of have to think about the people that might not be and how big those fears might be. And it could be something as simple as having diabetes that can put you at a higher risk. If you think about how many people in our country have diabetes or a heart disease, those are two of the major chronic illnesses that we have in our country. And those people are at a heightened risk. So while you yourself may be okay, I think being prepared is smart. I don't think anyone needs to be freaking out and spending $700 on hand sanitizer. So there definitely is some overreaction. I don't know if that really answers your question. I'm kind of in between. I don't know if anyone else has thoughts.
I would say that the consensus earlier that like if you're above the age of 65 or even 80, that's like a big concern. I read somewhere, or I think I listened to a podcast about how like one individual, like one healthcare worker at like a senior retirement home had COVID-19, and like the majority of those people at that home now are infected, and they are at a high chance of, like potentially like passing away as a result of COVID-19 because they have those compromised immune systems. So I think we definitely need to be cautious and wary. We just don't want to overreact. And I feel like in this, I would say that right now, some media outlets are probably overplaying it, but I don't think I think like what was especially concerning in like early January, late December was the lack of coverage or the dismissal of COVID-19. So I think the more coverage there is, the more ability that people are able to, wash their hands more often, which, a lot of people don't do, or like trying not to touch your face and things like that. So I think it's sort of a double-edged sword.
Yeah, and on that note, remember, it doesn't take a pandemic for it to be important for you to wash your hands and not cough on people. So those are just like general public health advisements that everyone should take into account. And so I hope that was helpful. Okay, so I think this question is more one that Caroline can handle than either me or Brandon. But so Hannah asks that her school is thinking about canceling their trip to New York, but is that a reasonable decision if it's in late March?
Oh, it's a tough one. It's hard to say. So what I can say is I think any school, first and foremost, is just trying not to contribute to the problem. So that could be twofold. That could mean that you guys go to New York, and there are a lot of cases in Westchester outside of the city that could spread. Obviously, New York is the most densely populated city in the country, so things can spread very rapidly there. So that could mean you bring that back to your own community. It also means that you could bring something from your community to New York. Or it could mean nothing and everything could be totally fine. I think most schools, coming from as a teacher and a partial administrator are going to err on the sides of caution, just because they do not want to be involved in anything that could come back to them, which is actually why a lot of companies are having their employees work from home. They don't want to be the method in which this thing is propagating, right? And so I think that's probably where your school is coming from, is like, God forbid that something happens, they don't want to be held accountable to it. And your safety is their first and foremost priority. So I do think it's a reasonable decision. I don't think it's the only decision. I think time will tell. I mean, I guess that's only a few weeks away, and I don't think the virus is going to diminish at all before the end of March. May it diminish by May, like AP season? And I see Robbie answered Lewis's question about AP tests, so take a look in the chat if you were looking for an answer to that. Yes, I think we could definitely see a strong decrease by then. By the end of March in the most densely populated city in the country, probably not. So again, I'm sure your school's just looking out for you, but I can also imagine that's incredibly disappointing.
Yeah. Okay, here's another one. Sky asks, if more than 50% of people in the US end up contracting COVID, as you said, will the government be able to support free coronavirus or COVID-19 tests? If not, is there a chance that this disease could end up disproportionately affecting people living below the poverty line who can't afford good health care? So this is actually something that Democrats are using in order to talk about like making healthcare more affordable and accessible, right? Because I don't remember where I saw this like specific tweet or who said it, but someone said that your healthcare is only as good as like the person who has the least access to healthcare. So if someone has potentially contracted COVID-19, but they aren't able to go see the doctor and they aren't able to like quarantine themselves and they end up like going out into the public, then that's a potentially, it makes more people be at risk for contracting the virus. And so any thoughts, you guys?
Yeah, I think I would concur that first of all, I don't think it's realistic that the government will support free COVID-19 tests. That's because first off, I think the US CDC rejected the World Health Organization's like test kits, saying that like they wanted to develop their own. Many were saying that like, you know, America wants to be the innovator in terms of like the tests and the vaccines. So that's why we're rejecting a lot of the tests from abroad. Because comparatively, like we've tested maybe like less than 1,000 people, or that might be like a rough estimate, but like South Korea has tested over like 1.8 million people. And in the country of South Korea, you can literally pull up to like a drive-through, get tested, get results in 10 minutes and go home and be on your way. That's not something that's happened in the United States, mainly because I feel like the administration has been a little bit more dismissive towards the issue of, or like not dismissive, but they've been trying to save face. They don't want, you know, President Trump does not want to go down as the president who mishandled the COVID-19 outbreak. So obviously he's trying to calm public pressure or public fear, excuse me. He's trying to, you know, make it seem like it's not that big of an issue. Like if you go to twitter.com/realdonaldtrump, the majority of those tweets you'll see are very like the flu has killed more than COVID-19. It's nothing to worry about, things like that. But I would say, to answer your second part of the question, that was like, would people with a lower income be disproportionately affected? Yes, like very much so. I think I saw President Trump say on some media outlet that like, oh, if you like even if you have symptoms, maybe going to work wouldn't, or like I think his exact words was going to work could make you healthy or something like that. And that's like, you know, a lot of the issue with like minimum wage jobs and jobs at the lower end of the income bracket are that if you don't show up to work for enough shifts, you get fired and you get back into that cycle of poverty and unemployment. So, you know, people will be, especially at the bottom, like who their income, they live paycheck to paycheck. That's how they put food on the table. They may say, oh, I can't stay home. I don't have paid sick leave. I'm going to go to work even if I have symptoms. It's probably going to increase the spread. It's probably going to lead to like a worse impact. But I think that's worst case scenario. I don't want to like be screaming doom and gloom, but like it's still a potential.
Totally agree. And I think I would just go back to the fact that this is the problem with healthcare in our country, is that there's always a disproportionate effect on people living below the poverty line. So something to keep in mind, like the choice to go to a hospital and be quarantined and be in the hospital for 14 days could be a couple $100,000 decision if you don't have insurance. So these are things, and as Brandon was saying so eloquently, a lot of people are working hourly jobs. They don't have the luxury of work from home. And so they are going to be more susceptible and also less able to get the help that they might need. Yeah.
Okay, and so that's all the questions you guys have submitted. But if you have any more, go ahead and submit them now, and we'll do our best to answer them. Thank you so much for tuning in. We hope that me, Eric, Brandon, and Caroline made this as informative as possible. And on that note, Hannah asks, what was the problem with the original test kit made by the CDC? I don't know what the exact thing was, but the article I read said that there was a chemical that had been manufactured and it was like not working properly. So they had to like restart and like remanufacture that specific like chemical or component of the test kit. And so it wasn't all of the test kits that were faulty, but it was enough of them to like have the CDC want to like make sure they were getting it right. And so they wanted to like redo that. And so, yeah, that was the problem with the test kits. And so,
sorry. I think like one consequence of the like failed test kits was I think one person in like Northern California, I think they like got tested, it came back negative, but then like it turned out they did have COVID-19, so that was a problem because then there was community spread. So like, and that individual didn't have any travel history to China, South Korea, or Italy, or any of those infected places. So it was problematic, especially in that they were tested, they never flew anywhere, and then they like went into the populate and like, you know, went into the public thinking they were like chilling or they just had the cold or flu, when in reality they had COVID-19.
Yeah, and so that's kind of what Eric was talking about earlier, where like they don't know exactly, and we like can't really know exactly where COVID-19 started, and that's just something that's like going to be, it needs more research to figure out. And so someone, Karina, I think it was, asked if the outbreak's too big, will AP tests be canceled? That's not exactly something that I think any of us like know and are able to predict, but Robbie did provide one of the answers to that in the chat. And so it was the Trevor Packer from the head of AP at College Board. And so they're just planning on having tests go on as planned with the usual opportunities to retest. And so, yeah. It looks like there's no more questions. And so thank you for everyone who tuned into today's stream. We know how important it is to make sure that we debunk any misinformation that comes our way, and to make sure that when it comes to public health, especially, everyone has the most up-to-date information that's possible. And so huge thank you once again to Brandon and Caroline and Eric for helping out with today's stream and giving everyone more context and information on how to stay safe and what the implications of coronavirus, COVID-19 specifically, will be in the future. So thanks, guys, and we'll see you next time.